guys, welcome back to Medical Coding with Blue. Today's episode is all about what kind of a career is medical billing and coding, and questions to ask yourself if you should pursue medical billing and coding. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so I got a message from a viewer and I'm gonna read it and then we're gonna get into it. So here we go. So the viewer says, "Hi Blue, I just discovered your YouTube yesterday. I have a few questions. Is the CEHRS, and that is a Certified Electronic Health Record Specialist, this is a gimmick certificate, and I will talk about that here in a minute, that I do not recommend, by the way. Is the CEHRS a receptionist type of job where you speak a lot by the phone all day? Is it better to study coding only or coding and billing together? I'm bad at math, LOL. But I want a data entry, high income job like medical coding. I would love to study with AAPC, but I don't have the $4,000. I think I will enroll in a school, I'm not going to name, which is a 9 to 11 month program. Thanks, dear Blue. Have a nice day." Okay, so here's the thing. First and foremost, you got to know, if you are seriously looking at becoming a medical coder that is going to be taken seriously in the industry, you need a serious credential to do it. There are 4 main medical coding certifications, and all you need is one. As a medical coder, that is all you need, because when you look in the job listings, they only ask you for one, all right? The CCS, that is a gold standard of medical coding credentials. The CCA, the Certified Coding Associate. The CCSP, or the Certified Coding Specialist Physician-Based, are all medical coding credentials with the American Health Information Management Association. The CPC is the flagship credential for the American Academy of Professional Coders, and that is a certified professional coder. Now, employers don't care which one you have most of the time, but they want you to have one of these 4. All you need is one. Now, I did mention that the CCS is the gold standard because that is the mastery of inpatient and outpatient coding. Now, the only other one is the CCS, the CCA. CCA also says that you know inpatient and outpatient coding in one credential, but this says that you have the entry-level competence, okay? I had this credential for many years. It is a wonderful credential. It is a very difficult exam to pass. It has the most domains of all medical coding certifications. So that is just something that you should know. So that being said, when I mentioned the CEHRS, that is a gimmick certificate. It's not even a credential, okay, guys? But these schools will sell it like it is a credential. Oh, you're going to make yourself look so much more advanced with your knowledge and everything. You're going to make more money because you have more credentials after your name, and you need this. No, you don't. The Certified Electronic Health Record Specialist just says that you understand the fundamentals of an electronic health record. Well, guess what? Every hospital, facility, doctor's office, any nursing home, they all use different electronic health records, all right? So because of this is, again, a gimmick certificate that they're trying to sell the school with. There's others too, and I don't want to say the other ones because they're not going to get any airtime on my show. The 4, you just need to pick one: CCS, CCA, CCSP, or the CPC. Any one of these and you are good to go. I have plenty of videos on my channel talking about each one of them, so please take the time to look through my videos so that way you can pick which one is right for you. I even have a video out that says which medical coding certification is right for you. So if you're interested in that, make sure that you do your research, okay? The thing that I will say about this individual, she is not doing her research because she's trying to separate out billing and coding, or should she just study for the coding, okay? In any of these 4 main medical coding certifications, we are all tested on reimbursement, which means we are tested on billing. Medical coders have to understand billing because that is what we do directly affects the billing side, right? The codes that we're reporting, it affects the billing side. So just make sure that when you're picking a program, that the program is preparing you for the CCS, the CCA, the CCSP, or the CPC. Any one of these, and then you're already on the right track. But if they're trying to sell you this other riffraff, then that's when you want to run, okay? It has to be one of those four, okay? And the other thing that they said is, and I took a little bit of like to that because people have been saying it in the comments lately. I don't know where this is coming from, but it's a little irritating because medical coding is not a high income data entry profession. What it is we have to look at documentation that is written by a provider. So we have to know what doctors know while never having gone to medical school. It is possible, even though you may not have any background in medical. I didn't have background in medical. We can learn. So that's something that you have to know right out of the gate. But the thing about it is we have to read and comprehend. And then we are working with the electronic health record. We are using a mouse to clicky box and things like that. So that is what we do, okay? Now, it is not data entry. It is not a high income data entry job, if that's what you're thinking that the whole thing is. Medical coding, the profession, does pay very well. Now, we don't go into specifics on my channel about how much medical coders make, and I will never talk about specific dollar amounts of what medical coders make, because there's a difference in wherever you are in the United States. The starting salary for a medical coder, every place is going to be different. In Florida, they're going to pay different from Michigan. Texas is going to pay different from New York, and New York is going to pay different from California because of the economy, the local area. It is going to pay differently. But if you are getting into the industry based on the fact that you want to chase the money, and like this person says, she wants a really high income job, the data entry, to me, that's not a reason to pursue medical coding. I have seen many medical coders who are in the industry who are miserable because they did it to pursue the money. They are not happy with what they're doing, and they can't find any peace because that's what they're chasing. And when you chase it, it's going to be more elusive to you. If you go in based on, okay, I need to build my knowledge base so that I can become a really great medical coder. Very knowledgeable medical coders are the ones that get paid more because their knowledge demands more money, okay? That's where you have to really think. It's separate. You can't just go into it saying, I want to make a high salary, but not put yourself in it, right? Now, I don't know this person. She may put herself in it. She may really study hard and she may go far and do those things. But do not let that be the reason that you're pursuing this. Because if that's the reason, again, you're going to find that you're going to run into a lot more obstacles than somebody who is really into it because they want something that is going to be long-term for themselves. And they like an intellectual challenge. And when you like an intellectual challenge and when you enjoy reading, because that's what this requires, is a lot of reading. And there's people who tell me, well, Blue, I didn't know it was this much reading. I don't want to do this. That's what we do, guys. 90% of the day is read. The other 10%, we are communicating with our providers. Sometimes it's a little bit more than that on certain days. But you have to be flexible in order to do that. You have to be able to communicate with really strong personalities, and you have to be able to communicate with really highly intelligent people. And that's part of my draw to this too, is because I love intelligence. I seek intelligence, and that's the thing that when I'm communicating with my providers, I enjoy. I like the intelligent conversations. I like the challenge of, okay, I got to figure this out. I've got to understand what they're saying. I want to speak their language, because if I can understand providers and how they speak, how they think, what makes them tick, this is going to make my job a lot easier. And it has. Once I understood that, that made all the difference in the world for me. I started a few years ago to read the New England Journal of Medicine. Now, why would you read the New England Journal of Medicine, Blue? You're a coder. You're not a doctor. I understand. But in order to understand them, I need to put myself in their spot and how they're thinking. Because this magazine, this online community is basically doctors talking to other doctors. There's not that filter that these doctors feel that they have to put on when they're talking to people who are not doctors. You ever notice that, right? When doctors are talking to like their patients, and even when doctors are talking to their nurses, they kind of change how they talk. But then when you hear them talk to the other surgeons and things like that, they have a different way of speaking. And so in order to really grasp what you're doing as a medical coder, it's important to put yourself in those environments, and you put yourself in that frame of mind so that way you can understand where they're coming from. This is a side that medical coding schools don't tell you about because they don't want to scare you. But I'm telling you, as somebody who is a successful medical coder, who has loved what she's done for 15 years, and who had her aha moment in 2014 when she finally got it. When I finally got it in 2014, and I have felt like I have not been working since 2014. I am very privileged to have that. There's a lot of people who will work their entire lives in a job, and this is where I go to collect a check and I go home. And then they say when I retire is when I'll be happy. I don't have to wait till retirement. I'm happy now. I love what I do. I love my providers, even though sometimes they make me chase them down the hallway. But I love them. I love working with them. I enjoy teaching them. I enjoy when I see that look of, now I get it. I love that. I love hearing from providers who have left my facility, who still call me up to ask me questions and see how I'm doing. That touches me. That touches my heart in so many ways, because it's like how these teachers feel, right? And when their students come back and see them after graduation and they're like, hey, I did it, it's that same feeling that I get, or I can imagine, because I'm not a teacher like in the schools, but that's something I could imagine that they would feel like, and that sense of pride that they did something and that you built a relationship that is based on trust, and they know they can trust you to help them, and so that is what I like, but I don't want to get off topic too much, but that is what medical coding is. It is understanding doctors. It is understanding advanced documentation. It's not impossible. So please don't think that I'm trying to discourage you, or all of a sudden you feel so discouraged because, oh, I didn't know it was all this. I'm telling you now. You're in it now. And believe it or not, medical coding actually does seek out certain people. I feel like medical coding found me, because trust me, I had no idea at all what medical coding was when I first got into it. When I first got into it, I was unemployed. I was at the workforce office, and they were saying that, oh, you have to attend this class, and it's about these educational funds that we have. So if you want to be trained in a new trade, and then you get a job in the field that you were trained in, you don't have to pay us back. It was the funds that they had in this program. At the time, it was WIA, Workforce Innovation Act. And now it's Workforce Innovation and Opportunity Act, the WIOA program. It is still out there. I will leave the link for it in the description box. If you are unemployed, if you are in a low wage paying job, they do have funds. So you can see if you qualify in order to get your schooling paid for, okay? And so that is just an option out there. There is money out there to be able to better your life and better your career. But you have to look, okay? And so I got involved in that, and when I saw what I was told a reasonable starting salary, and I was like, oh, okay, but it wasn't the reason that I pursued it. I was pursuing it because they were telling me this is a long range field. You can be in this for your whole career, and you can do a lot. You can grow. It's not just doing coding, it's doing other things later on as you advance. And, it's moving up, and so it's up to you if it's, what you want to do. And I'm like, oh, and my case manager was like, if you decide that you go to the school and you don't like what you hear, that's okay. He goes, come back and we'll put you in the accounting program, because I like numbers, okay? I'm a numbers nerd, and so I said, okay. So I went and I checked out the school, and I said, okay, I think I can do this. And then I got in it, and I started thinking like, oh gosh, I have to know all this medical terminology and anatomy. That's so weird, but okay, let's go along with it. And I breezed through that. I breezed through medical terminology because I was enjoying it. And then I get to my first job, and then I get to my second job, and both of these were courtesy of the temporary agency that I got hired on with. And that led me to my forever home, and I've been here ever since. And the fact that I did not go in based on the money, based on chasing it because of the money, my salary progressively went up. So I started at a good rate at my first place. The second place I went, it wasn't a couple cents jump. No, this was a huge jump when I went to my second place. And again, I went to a huge jump on the third place. So, or my forever home now. So I was able to, I thought I was doing good with the first one, but then I was like, wow, I didn't know that this was all what was in store for me. But because I was not concerned about all that, I was concerned about like, gosh, I've got to catch up. I have got to figure this stuff out. What I don't understand, I have to really dig in and try to figure it out, or find somebody to help me to figure it out. And so I did. And so doing that along the way, again, I'm rewarded financially because I didn't worry about that. I didn't worry about that. And it's taking care of me, but I take care of it. Okay, it's a two-way street with medical coding. Okay, you'll find that you will get rewarded, but you do have to work hard for those rewards. It's not something that is just going to be handed to you willy-nilly. When I see people out there with unreasonable expectations of salary when they first start out, I'll see those things on LinkedIn. And I'm like, really, are you kidding me? It sickens me because this is a career field that I love. And I know that there's so much more rewards for it. And I wish people would look at those things and not just, oh, the money, the money, the money. They don't realize that you have to work really hard for that money. And with that money comes a lot of responsibility. A lot of responsibility. You know, we are responsible for the things that we are selecting. You know, when it comes down time to audits and things like that, facilities, financial health and wellness depends on medical coders. I talked about this last week on Thursday's Live because of the simple fact that what we select is submitted to the insurance company. And if the insurance company is paying it, it doesn't necessarily mean that, oh, yes, we're always constantly doing right, because the insurance company can go back at any time and run an audit and say, oh, you know what? We've been paying all of these claims this whole time. And you know what? Y'all are wrong. So now you're going to owe us money, and we're going to collect some interest because, you know, y'all didn't tell us that it was wrong either. Right? So again, there's a lot of things that are involved in medical coding. But the questions that you should ask yourself, am I chasing this for the money, or am I chasing this because I want something that's going to fulfill me intellectually? Maybe you haven't worked in some years. Maybe you've been a stay-at-home parent and you say now that you want to go back to work, but you want something that's going to challenge you, not something that you're not just going to be like some not thinking having to do, right? Some activity where you don't stretch your brain. And some people don't want to have to think so hard on, you know, whatever their job is. But some people crave that. Some people really want that. And they're like, no, I want something that's going to challenge me and make me think and push me to be a better professional and a better person at that too. And so then if you're saying that, okay, then this may be for you. If you say to yourself, can I commit to 20 hours per week of study? Oh, no, Blue. No. I don't think I can do this now because, you know, I have a full-time job. I've got kids. I've got an old lady or an old man, and I've got to take care of them. I've got cats. I've got a whole farm. Okay, guys, you can actually make time for the things that you want to do. And it's not 20 hours in one sitting, okay? It's 20 hours spread out during the week. So that way on the weekend, you have either off, no studying at all on Saturday and Sunday, or you just have 2.5 hours to do on Saturday or Sunday. But if you do 3.5 hours, 30 minutes in the morning, 30 minutes, and you could do that while you're driving, you can listen to something. That's studying. Listening to something, watching a video about medical coding or medical terminology or anatomy, that's studying, guys. Working with the workbooks, that's studying too. 30 minutes at lunch, 30 minutes on your way home, 1 hour in the evening after you've done cooked and everything and cleaned up the house or whatever, 1 hour and then another hour. That's 3.5 hours in one day. You do that for 5 days straight, that's 17.5 hours that you've completed of study. And then you just have that 2.5 hours on the weekend. And if you do that over the course of your 9-month, 12 months, or 18-month program, and even though you say, well, Blue, my program's only 6 months, you could study for an additional 3 months. If you do that over 9 months, 12 months, or 18 months, you will be prepared for your medical coding certification, because that's sufficient amount of time to be able to put towards studying. And you'll be confident with your books, and you'll be confident with the things that you are learning. But if you're going to be all like, well, it's a 3-hour class that I have, and that's the only days that I study is, the days that I have a class, and it's 3 hours and another 90 minutes, in the middle of the week, and I'm only studying 5 hours a week, that's 20 hours in a month versus somebody who is studying 20 hours per week and making 80 hours in a month. It is possible, guys. Okay? Can you commit? It's not forever, guys, with this 20 hours per week. It's not forever. It's just for you to get a foundational learning and knowledge on medical coding. And then it'll be all about maintaining and growing your knowledge after you get your certification. All right? And then when you're out there in the real world. This is what it takes, folks. And the other question that you can ask yourself is, will I give up so easily? And if you say, yes, Blue, I give up easily all the time, then this is a pinnacle moment in your life then, right? Pinnacle moment. For you to make the decision, for you to decide, am I always going to be running from a career, starting a career, or doing something because I've got other people in my ear telling me I can't do it? Am I always going to run? Oh, well, I always run and I never believe in myself. Why don't you start believing in yourself? Why don't you start? You can start somewhere. And if you say, well, I would love to be able to have a nice place and have a nice vehicle and be able to, pay for vacations and do all of these things. It takes work. It takes sacrifice. It takes diligence. It takes consistency. You ever hear those things out there that they say all the time, consistency is the key to success? It is. It is, because somebody who's, again, studying 20 hours per week over 9 months, 12 months, or 18 months to learn medical billing and coding, those are going to be the successful ones because they've been consistent. And yes, sometimes life will get in our way. We're all adults and we can't do something, or some emergency comes up, but it doesn't mean we can't get back to it. It doesn't mean we can't stay motivated to look at our goal and to be able to achieve our goal. So if you give it up, if you give up things so easily, if you get easily discouraged, it may not be for you. And I don't say that to discourage people. I tell you all that because I care. I don't want to see people taken advantage of. You know how many programs are out there that they charge through the nose and they give you poor education? $500 or $1,000 off a poor education is still a poor education, I say. But if you are being poorly educated and you really want this, find yourself a mentor or find a tutor, okay? Somebody that can help you to understand it. There's plenty of people on LinkedIn. If you put out a post and you say, I need a mentor, there are going to be people who will volunteer or know somebody who will volunteer. There's also plenty of tutors out there. I'm a tutor myself. My rate is in the description box below. There's a ton of tutors on LinkedIn, okay? So all you have to do is just put that feeler out there too, and you'll find somebody who's a tutor, okay? So that's just what I have to say. But guys, it's not an easy field, but it is such a rewarding field. It is. It really is. And it will give you what you give it. If you give it a lackadaisical attitude, it's going to give you a lackadaisical attitude. But if you give it 120%, it will give you 150%. It will always give you more than you give it, okay, if you give it your all. That's just what I'm saying. So I'm going to go ahead and wrap this one up. Thank you guys so much for joining me. Best of luck to you on your career search. If this doesn't happen to be your cup of tea, that is okay. It is okay. At least you know now that it requires all of that. But make sure that when you are pursuing something, that you pursue something that you're gonna give it a try. Okay, you're not just going to run from it just because you hear one thing you don't like. I'm just saying. So I'm going to wrap this one up. If this video helped you, please like, subscribe, and share, and I will see y'all next time. Bye.